Teenage pregnancy. What is teenage pregnancy? Teenage pregnancy, also known as adolescence pregnancy, is pregnancy in a female under the age of 20. According to the World Health Organization, pregnancy can occur with sexual intercourse after the start of ovulation, which can be before the first menstrual period but usually occurs after the onset of periods. In well-nourished girls, the first period usually takes place around the age of 12 or 13. So, according to the World Health Organization, teenage pregnancy is pregnancy in a girl under the age of 20. So, like 19, 18, 17, 16, 15, 13, 12, or 11. So it can happen after the beginning of ovulation, which can happen before the first menstrual period. So usually the first menstrual period of a girl is 11 or 12 or 13. So it depends. There are some girls that are 10 years old having their first menstruation. Although normally occurs after period begins. What is the main reasons of teenage pregnancy? The main reasons for the high rate of teenage pregnancies are inadequate sex education and a lack of access to birth control. So, we all know that inadequate sex education can result in pregnancy, and a lack of access to contraception is also the main reason of teenage pregnancy. So, some girls do not know that having sex can result in pregnancy or fully considered the responsibility of having children. Effects of teenage pregnancy. Teenage births result in health consequences. Children are more likely to be born preterm, have lower birth weight, and higher neonatal mortality, while mothers experience greater rates of postpartum depression and are less likely to initiate breastfeeding. So, most of the teenage mom experience depression, so it can really affect the mental health of the teenage mother and could affect the physical health of the baby. This teenage pregnancy can really affect both the mother and the baby because it will affect their physical health and mental health. So it can possible that the baby will be delivered not healthy because it is not the right age of the mother to be a mother. That's why it can affect their physical and mental health. Prevention of teenage pregnancy. There are many methods available to help prevent pregnancy, including IUDs, birth control pills, and condoms. So, using effective contraceptives such as condoms, birth control pills, the patch, the vaginal ring, the intrauterine device or IUD, and/or injectable birth control methods. Every time they have sexual intercourse will reduce the chance of unwanted pregnancy. So there are many ways to prevent the teenage pregnancy like birth control pills, condoms, and many more. So these days, the birth controls, the contraceptives are very affordable. So if the teenager, if they really want to have to experience sexual intercourse, they can afford the birth controls. So maybe it's the best thing that they will use because just to avoid the chance of having just a chance of being a teenage parents or teenage mom. But for me, sex education is the number one and most effective way to prevent this kind of issue. And it will help to educate the teenagers. This will help not to stop the teenage pregnancy, but to lessen this issue, which is the teenage pregnancy in this world.